It's time for a major reality check. Those pills you pop without a second thought, they might be sabotaging your health right under your nose. In the next few minutes, we're going to blow the lid off 5 common medications that could be doing you more harm than good. 5. Antidepressants. Antidepressants are a lifeline for many people dealing with depression and anxiety. However, they're not as simple to use as many might think. One of the biggest mistakes people make with antidepressants is stopping them abruptly. When you've been taking antidepressants for a while and start feeling better, it might seem logical to stop taking them. After all, you're feeling good now, right? Wrong. Suddenly stopping antidepressants can lead to what is known as discontinuation syndrome. This can cause symptoms like dizziness, nausea, and even flu-like symptoms. In some cases, it can even trigger a relapse of depression. Another common misuse is not taking antidepressants consistently. These medications work by gradually adjusting the balance of chemicals in your brain. Skipping doses or taking them irregularly can disrupt this process and make the medications less effective. It is also crucial to understand that antidepressants aren't a quick fix. They typically take several weeks to start working, and finding the right medication and dosage can take time. Some people give up too quickly if they don't see immediate results. Remember, antidepressants are powerful tools in managing mental health, but they need to be used correctly. Now, let's move on to our next medication, which is often prescribed for anxiety and sleep issues. 4. Benzodiazepine. One of the most significant issues with benzodiazepine is their potential for dependency. These medications work quickly to reduce anxiety and promote sleep, which can make them seem like a magic solution. However, over time, your body can build up a tolerance, meaning you need higher doses to get the same effect. This can lead to a cycle of increasing dosage and dependency. Another common misuse is taking benzodiazepine for longer than prescribed. These medications are typically meant for short-term use, usually a few weeks to a few months. Using them long-term can increase the risk of side effects and make it harder to stop taking them. Mixing benzodiazepine with alcohol or opioids is extremely dangerous. This combination can severely depress your central nervous system, leading to slower breathing, unconsciousness, and even death. It's crucial never to mix these substances. Some people misuse benzodiazepine by taking them as needed for every stressful situation, rather than addressing the root cause of their anxiety. While they can be helpful in managing acute anxiety attacks, they're not a long-term solution for ongoing stress or anxiety. Stopping benzodiazepines abruptly can also be dangerous. If you've been taking them regularly, even for a short time, you should always work with your healthcare provider to taper off slowly. Sudden discontinuation can lead to withdrawal symptoms, which can be severe and even life-threatening in some cases. Remember, while taking benzodiazepines can be very helpful when used correctly, they require careful management and should always be taken under close medical supervision. Moving on, let's talk about a type of medication that many of us have taken at some point in our lives. Number 3. Antibiotics. Antibiotics are truly miraculous drugs that have saved countless lives since their discovery. However, their effectiveness is being threatened by widespread misuse. One of the most frequent mistakes is not finishing the entire course of antibiotics as prescribed. You might start feeling better after a few days and think it's okay to stop taking the medication. However, this can allow some bacteria to survive and develop resistance to the antibiotic. Always complete the full course, even if you feel better. Another common misuse is taking antibiotics for viral infections like the common cold or flu. Antibiotics are designed to fight bacterial infections, not viral ones. Taking antibiotics when you don't need them not only won't help you feel better, but it can contribute to antibiotic resistance. Sharing antibiotics with others or using leftover antibiotics from a previous illness is also a form of misuse. Different bacterial infections require different types of antibiotics, and using the wrong ones can be ineffective or even harmful. Always get a proper diagnosis and prescription from a healthcare provider. Some people try to self-medicate with antibiotics they've purchased without a prescription, which is both illegal and dangerous in many countries. This can lead to using the wrong type of antibiotics or incorrect dosing. It is also important to take antibiotics exactly as prescribed. This means taking them at the right times and with or without food as directed. Some antibiotics need to be taken on an empty stomach to be effective, while others should be taken with food to reduce side effects. Remember, antibiotic resistance is a growing global health threat. By using antibiotics responsibly, we can help preserve their effectiveness for future generations. Now, let's move on to a type of medication that many people don't realize can be harmful if misused. Number 2. Laxatives. Laxatives are medications used to treat constipation, but their misuse is more common than you might think. While they can provide relief when used correctly, improper use of laxatives can lead to serious health issues. One of the most dangerous forms of laxative misuse is using them for weight loss. Some people believe that taking laxatives will help them lose weight quickly. However, this is not only ineffective, but can be extremely harmful. Laxatives don't prevent your body from absorbing calories or fat from food. Instead, they cause dehydration, electrolyte imbalances, and damage to your digestive system. Another common misuse is overusing laxatives for constipation relief. While occasional use for constipation is generally safe, regular use can lead to dependency. Your body may start relying on laxatives to have bowel movements, making it difficult to go to the bathroom without them. This can lead to chronic constipation and damage to the nerves and muscles in your intestines. Some people might use laxatives to cleanse their system, believing it will remove toxins from their bodies. However, our bodies have natural detoxification systems, primarily the liver and kidneys. Excessive use of laxatives for this purpose can disrupt your body's natural balance and lead to health problems. It's also important to be aware that different types of laxatives work in different ways. Using the wrong type for your specific situation can be ineffective or even harmful. For example, bulk-forming laxatives like Xylem need to be taken with plenty of water. If not, they can actually worsen constipation or even cause an intestinal blockage. Lastly, some people might use laxatives to cope with eating disorders. This is extremely dangerous and can lead to severe health complications. Now, let's move on to our final medication, which is perhaps the most commonly used and misused of all. Number 1. NSAIDs. This category includes over-the-counter painkillers such as aspirin, ibuprofen, and naproxen. While these medications are easily accessible and widely used, their potential for misuse and associated risks are often understated. One of the most common ways for people to misuse NSAIDs is by taking them too frequently or in higher doses than recommended. Many people think because these medications are available without prescription, they must be completely safe. However, regular overuse can lead to serious side effects, including stomach ulcers, kidney problems, and increased risk of heart attack and stroke. Another issue is using NSAIDs for extended periods without medical supervision. These drugs are generally meant for short-term use to manage acute pain or inflammation. Long-term use, especially at high doses, can cause risk of side effects. If you find yourself needing to take NSAIDs regularly for chronic pain, it's important to consult with a healthcare provider to explore other treatment options. Many people are unaware that different NSAIDs can interact with each other. For example, taking aspirin with ibuprofen can reduce the heart-protecting effects of aspirin. It's crucial to read labels carefully and avoid taking multiple NSAID products simultaneously, unless directed by a healthcare provider. NSAIDs can also interact with other medications. For instance, they can increase the risk of bleeding when taking blood thinners like warfarin. They may also reduce the effectiveness of some blood pressure medications. Always inform your healthcare provider about all medications you are taking, including over-the-counter drugs and supplements. Another common misuse is taking NSAIDs on an empty stomach. These medications can irritate the lining of your stomach, potentially leading to ulcers or bleeding. It's generally recommended to take them with food or milk to reduce this risk. Lastly, some people may not be aware that certain health conditions or lifestyle factors can increase the risk of side effects from NSAIDs. For example, people with a history of stomach ulcers, kidney disease, or heart disease may need to avoid NSAIDs or use them with caution. Alcohol use can also increase the risk of stomach bleeding when combined with NSAIDs. Remember, while taking NSAIDs can be very effective for managing pain and inflammation, they are not without risk. Always use them as directed, and don't hesitate to consult with a healthcare provider if you have any concerns or questions about their use. We hope this video has been eye-opening about the potential dangers lurking in your medicine cabinet. Remember, knowledge is power when it comes to your health. If you found this information helpful, please don't keep it to yourself. Share it with someone who might benefit from it too. We are committed to bringing more vital health information like this. So if you haven't already, hit that subscribe button and turn on the notification bell. Have you ever misused any of these medications without realizing it? Or do you have any questions about medication safety that we didn't cover? Drop a comment below.